Hello everybody, welcome to my YouTube channel Nurse at Simplified. Today we will talk about a very simple topic, respiratory acidosis versus alkalosis. So this is a very important topic when it comes to ICU and critical care management. So we will have a quick glimpse of it. So first we begin with the basic definition. What do you mean by respiratory acidosis and how is it different from alkalosis? So respiratory acidosis is caused by CO2 retention, that is carbon dioxide retention, and a condition where the lungs can't remove enough carbon dioxide, which brings down your pH. So how is it happening is like your body, as we know, because of your cellular metabolism, the byproduct is carbon dioxide. So normally the lungs exhale the carbon dioxide that maintains the blood pH. Excellent, sir. But now what happens is in respiratory acidosis, the lungs are unable to remove the CO2, the carbon dioxide, leading to its buildup in the blood. And when carbon dioxide is dissolved in your blood, it reacts with the water to form something called carbonic acid, as we learned, H2CO3. And this process, as we know, is catalyzed by an enzyme called carbonic anhydrase. Now, carbonic acid dissociates into two compounds again, hydrogen and bicarbonate. The increase in hydrogen ion concentration lowers the blood pH. So is the concept clear that why high increase in CO2 leads to low pH? Because of the hydrogen ion concentration. So, and when your pH is low, automatically it becomes more acidic. There are some compensatory mechanisms taking place. That is, your kidneys are trying to compensate by excreting more high hydrogen ions and retaining the bicarb. But this is a compensatory mechanism. So, if the underlying cause is not treated, it continues and the compensatory mechanism fails. Now, this leads to the complication called respiratory acidosis. Similar, exact opposite is your respiratory alkalosis. It is caused by excess CO2 loss, and lungs, they remove too much of the carbon dioxide, which decreases your hydrogen ion, and that increases your pH, and it becomes alkaline. Your blood becomes alkaline. Etiology. Now, what are the conditions that can bring your CO2 down, or that leads to retention of CO2? COPD, asthma, drug overdose, respiratory depression, chest wall injury, that is your flail chest. What do you mean by flail chest? It is a severe chest injury where multiple ribs are broken, making the chest wall unstable. Okay, and at the same time, you also have pneumothorax, that is which is air in the pleural space, and you have hemothorax, which means blood in the pleural space, and also there are blunt injuries to the ribs. What are the conditions of respiratory alkalosis? When you have hyperventilation, panic anxiety attack. So what are you trying to do? You're trying to lose more CO2. Fever, pain, early sepsis, and when you are intubated and if you have a mechanical overventilation. What are your signs and symptoms? They are like respiratory acidosis. For both, you will have similar signs and symptoms with very minor differences between the both. In respiratory acidosis, your main stress will be you will have headache because your CO2 is increasing, drowsiness, confusion, and hypoventilation. In respiratory alkalosis, it will be hyperventilation. You will still have confusion, dizziness, numbness, tingling sensation. That is about alkalosis. You may have nausea, vomiting. The main difference between acidosis and alkalosis is the patient will come to you with a complaint of nausea, vomiting also. Why? Because your CO2 is low. Your blood does not have enough of CO2. So and symptoms like numbness, tingling, low BP, or maybe normal BP sometimes, but also tachycardia. Why? Because of the compensatory mechanism. ABG values, your respiratory acidosis will have pH obviously less than 7.35. PaCO2 will be more than 45 mm of Hg. Bicarb will be more than 26. And MEQ per liters, and in alkalosis pH will be more than 7.45, the exact opposite of all. PaCO2 will be 35 mm of Hg and below, and bicarb will be 22 and below. treatment for respiratory acidosis is obviously treat for both cases, be it acidosis, be it alkalosis. For both cases, we must improve ventilation, because the reason why it is because of the buildup of CO2. So what we have to do is we have to treat the cause. How do you do that? We You can either if it is for pneumonia, you can treat pneumonia. If it is because of COPD exacerbation, you can give bronchodilators, and you can give supplemental oxygen, and you can also give, like if it is due to drug overdose, sedation reversal like naloxone or flumazenil, and you may also support with BiPAP, CPAP or BiPAP. They maintain your airway pressure. So in that way, they support your ventilation. And mechanical ventilation, if there is if there is less of support for the CO2 and there is more CO2 retention, what we do, we give mechanical ventilation to support the breathing and allow the lungs to recover. For respiratory alkalosis, again, we treat the causes of hyperventilation. If it's fever, we do that. If it's because of panic, anxiety, we give them tranquilizers to calm down, and calm breathing, paper bag technique. We know it, huh? And correct the underlying conditions. Basically, for both, it is correct the cause. The acidosis and alkalosis, they happen because of a mechanism that's running under you. So treat the cause, treat the disease, and then you treat the acidosis automatically. So as we all know, next time you go to an ICU or a critical care unit or an emergency, whenever they take an ABG result in front of you, have a look at it and try to identify yourself. So as the goal goes, know first, automatically safety follows. Thank you so much.